Hi, I am Mr. Filey here to verify that I'm not cheating. I do have some supplies. I have a Q-tip and some gloves. I'm just going to sit over here. So first off, my name's Olivia. I have Miss Jordan here as my patient today. For starters, I would check the chart to make sure that I had an order to do this kind of assessment. It's going to be a head and neck assessment that includes musculoskeletal and range of motion. So then I would provide privacy as I went into the patient's room, wash my hands, identify myself and the patient. Hi, my name's Olivia. I'm going to be the nurse taking a look at you today. Can you tell me your name and date of birth?
Jordan Haney, October 20th, 1990.
Okay, so we do have a 27-year-old Caucasian female. I'm just going to set you up. How are you feeling today?
Good.
Good. Are you in any pain?
No.
No? Okay. Do you know where you are today?
Baker Hospital.
Baker Hospital. Do you know why you're here?
For checkup.
Okay. Can you tell me today's date?
October 23rd, 2017.
Okay. So my patient is alert and oriented ×3. Just as a general overview, I can tell that her skin is appropriate for ethnicity. It does feel warm. Alright. Just check your tinting real quick. Alright. Patient's skin is elastic. There's no tinting. Are you experiencing any pain anywhere? Any stiffness?
Mm-mm.
No? How about with your eyes? Any double vision? Anything like that? No? Any swallowing problems? Any smelling problems?
Mm-mm.
No? So cranial nerve 1 is intact. I also going to take a look at your nose, okay? Alright, so it does seem to be kink and moist. There's appropriate hair distribution inside of the nose. I will note she does have her septum pierced, but her septum is not deviated. It is symmetrical with the face. I don't see any bumps or lesions on the face or on the neck. I'm just going to take a look real quick. No nodules. The neck does seem to be symmetrical. So I am going to put some gloves on. Just going to check your hair, okay? I want you to tell me if there's like any pain or tenderness. Alright, so hair is evenly distributed over the head, the eyebrows, and the eyelashes. I don't note any like lesions or anything like that on the eyes. Take these off, throw them away, do some hand hygiene. Color is appropriate, it's clean, it's kept, there's no dandruff, there's no lesions or nodules. I do note that you wear glasses. Can you go ahead and take those off for me? And you said no double vision, no blurriness, anything like that. Alright, so just look straight for me, just want to look in your eyes. Alright, look far away for me, and then when I tell you, go ahead and look at my pen light. Okay? Alright, now I just want you to follow your eyes with my pen light, okay? Perfect. So pupils are equal, round, and reactive to light directly and consensually. They accommodate appropriately. I didn't notice any like ptosis or nystagmus, which is like that twitching with the cardinal gazes. So cranial nerves 2, 3, 4, and 6 are intact. I'm going to take this little cotton swab right here. Go ahead and close your eyes. I'm going to touch your face on 3 different spots. You tell me if it's sharp or dull. Dull. Okay. Sharp. Yes. And we're also going to do this on the feet. So just go ahead and tell me if it's sharp or dull.
Sharp.
Yes. Alright, so we'll put that over there. Go ahead and palpate this TMJ. Go ahead and open, close your mouth. A little bit of cracking. Is that normal for you? Okay. Cranial nerve 5 is intact. Can you go ahead and puff up your face? Give me a great big smile. Raise your eyebrows. So facial movement is symmetrical. So cranial nerve 7 is intact. I'm going to go ahead and look at your conjunctiva of your eyes. It's pink and moist. Any pain? Anything like that? No? So the conjunctiva is pink and moist, no inflammation. The sclera is white. It does have a little bit of bloodshot in it. You have seasonal allergies. And then the iris does seem to be like a grayish green, almost with a tint of blue in there. So I'm going to take a look at your mouth. Okay, can you go ahead and Stick out your tongue and say ah. Alright, lift up your chin. Give me a great big swallow. Alright. So the mouth is pink and moist. I didn't see any lesions, anything like that. The teeth are clean and all intact. Her uvula does deviate to the left a little bit. Is that normal for you? Okay. Her tonsils are at a +1 station. Her neck is symmetrical. I did notice the swallowings. So the trachea is midline. I didn't notice any enlargement or nodules on the thyroid, which is a good thing. Are you having any trouble swallowing? Any coughing?
Just from the allergies.
Just from the allergies? Okay. I would also use the Snellen chart, but for the sake of time, we're not going to do that today. And I would use an ophthalmoscope. We would check the fundus to make sure it's the appropriate color. It's like a creamy yellowish to a pink. The artery to vein ratio, and to make sure that I saw the red reflex with the ophthalmoscope. So I'm going to go ahead and palpate your lymph nodes. Okay, just tell me if there's any pain or anything. So we have the pre-auricle, the posterior auricle, the occipital, we have the tonsillar, the submandibular, the submental, we have the superficial cervical, we have the deep cervical chain, we have the posterior cervical.
Mr. Fuzzy, you know there are no notes, right?
And
can I just circle the video so that if you come in again,
the supraclavicular. So no nodes were palpable, which is a good thing. Any pain or tenderness?
Sorry.
No? Alright, so I'm going to take a look in your ears. Usually we would have an otoscope, and I would check the pearly tympanic membrane. Any drainage or any ear infections recently? No? So since she's an adult, I would pull the pinna up and back. We're going to pull the pinna today. Any pain? I'm going to push on the tragus and on the mastoid process. No? Alright, so I'm going to take a listen to your carotid arteries, okay? I want you to take a deep breath in and let it out, and then hold. Okay, go ahead and breathe. And we're going to do that one more time on the other side. Okay, so there were no bruise noted, which is good. Any pain or tenderness in the neck? No? Alright, so we're going to do some range of motion. Go ahead and touch your ear to each side. Hand down to the neck. Alright, any pain, stiffness? No? We're going to do that with the shoulder. There's no crepitation, no popping or cracking. A little bit of cracking in that wrist, that's normal for you. While looking at the fingers, we would want to note the shape of the nails. So they are cut and clean. There are a couple ridges in the nails, so we might want to do some follow-up labs. Cap refill is less than 3 seconds. And normally for range of motion, we would do it on both sides. But for the sake of time for this video, we're just going to do it on one. Go ahead and touch your nose, and then I want you to touch my finger. Okay, we're going to do range of motion in the legs. One more time. This is slow to pave you into the market. Alright, so we got good range of motion. She does not have her toenails painted, so cap refill is less than 3 seconds. They are clean, but I will note that she does have some fingernail polish on her toes. We're going to check for edema. Just a little bit, but we are nursing students, so that is normal. Go ahead and take your heel and touch your tibia, run it down your tibia for me, and do that on both sides. Okay, good. Go ahead and give me a big squeeze. I'm going to pull towards myself, I'm going to pull towards yourself. I'm going to push towards myself, push towards yourself. Go ahead and push down like you're driving a car. Okay, go ahead and lift your legs up. Alright. Okay, we're going to have you sit on the side of the bed. Alright, I'm going to say a word. I want you to close your eyes. I'm going to go ahead and say a word, and I want you to repeat back to me what that word was, okay? Yellow.
Yellow. Green.
Okay, so that does go along with cranial nerve number 8. Cranial nerve number 11 checks the shoulder strength, so go ahead and raise your shoulders. So cranial nerve 11 is intact. So go ahead and stand up for me. I want you just to walk a little bit that way and then walk back towards me. Patient does have an independent gait. She's steady and stable. Go ahead and bend down, touch your toes. All right, spine alignment does look normal. There's no curvature. You can go ahead and stand up and sit back on the bed. Let's see, just want to make sure that we went over everything. I don't notice any facial droop. I did mention that her lips are moist and pink. Alright, I do think that concludes today's assessment. Is there anything that you need before we go? No? Okay. Thank you.